Hi everyone, welcome to another episode of the Modern Woman podcast. Today we've got Nick, Elizma and Danielle back for another round, guys. So, and I guess today we're going to be speaking about a really, common topic that a lot of women we see in clinic and a lot of patients we see are dealing with. But it's actually a really multifactorial condition, and that is acne. So there's a lot that goes into that. So we're going to, delve into that today, piece together the underlying causes, factors, go through maybe treatments that are used conventionally and more from holistic treatment spaces. So yeah, we're just going to dive in and have a chat about acne, guys. So yeah.
Awesome. Well, Danielle, I've got some interesting statistics, because we often think of acne as an adolescent or issue or something that affects teenagers. Yes. But it's actually a lot more prevalent than what we think it is, with pretty much the age group of 11 to 30 being the major group of people who usually suffer from acne, but it can also happen in the 40s as well. So people in their 40s can also often have issues with acne. And I've got a few statistics here because women seem to be a little bit more affected than men, even though it certainly occurs in both sexes. They reckon about 3 in every 4 people between ages 11 to 30 have had some kind of a skin condition like acne or pimples or anything like that. And with women, they reckon in the 20s, it's about 50% of women and 42% of men experience acne in their 20s, which is a huge number. That's almost half, right? And then they have about 35% women and 20% men in their 30s. And then it drops off a little bit more to 26% of women and 12% of men in their 40s. But predominantly throughout, women seem to be more affected than men when it comes to acne. And as we know, it's not just a skin condition, is it? Because it will have definitely some mental health effects of, anxiety. I think a lot of women and men will kind of avoid social situations if they feel very self-conscious about their skin. Can lead to a loss of confidence, which can, affect relationships, even applying for jobs and things like that. So it can have, even though they may, look fine on the outside, they definitely wouldn't surprise me if a lot of people who do suffer from acne, it has like repercussions. So definitely much more prevalent than what we think of. And, if we kind of have to look at acne in how it starts off, it's important, I think, to kind of look at what the skin or the skin physiology looks like. So you obviously have the skin or the epidermis, and then you have your pores. We all have skin pores. And in this pore, there's a follicle. And in this follicle, there'll also be a hair growth, right? Now, underneath, at the bottom of this follicle, you'll have the little oil glands that's producing the oil that keeps your skin moisturized, because without that oil, you'll have very dry, scaly skin. So you do need some kind of oil moisturization there. And so this is kind of like where a lot of things can go wrong, is when there's that overproduction of oil from that oil gland, because the job of the oil is actually to take also a whole bunch of dead skin cells and kind of push it to the top. And that's like a self-cleansing mechanism of the skin. So we can have a couple of factors here involved with acne. First, too much oil production, and also then too much skin cell production within the pore. And so with all that oil and skin cells, it just gets clogged up. And then you get the redness and the swelling. And it also creates an environment for bacterial overgrowth, right? And then you get the pus and everything else that goes kind of along with acne. But in my opinion, the overwhelming factor with acne is inflammation. If we have to sum it up in one word, right?
Yes.
Yep. Yeah, it is an inflammatory condition, is how it's sort of described, essentially.
Exactly.
Yeah.
Mm-hmm. And I guess we can take it down to inflammation, not just of the skin, from the skin, I should say, but even gut inflammation, immune overactivation, whatever you want to kind of call it. And of course, everyone with acne, they may have different triggers that kind of trigger the acne. There's not going to be a one-size-fits-all like we already know. It's very rare that one thing is going to work for everyone. There definitely seems to be bacterial involvement in some form or other. But we always like to kind of work it back to kind of root cause and things like that as well, and not just look at it from a topical point of view. And I guess one of the big issues as well is, especially if there's cystic acne, is when they rupture, there's a much higher risk for scarring, isn't there?
Absolutely.
Yep.
And the scarring is often, irreversible from my understanding. I don't know if there's much that can be done with scarring unless you kind of like go and see a dermatologist. Maybe there's some treatments there that can help with scarring, but that's often the big thing, right?
Exactly. I think if it's that acne that has been chronic and it's that cystic acne that you're talking about, Elizma, it's that potential for scarring is something we have to consider. Now, I guess from a nutrient perspective, there's things that we can do from wound healing, and we can touch on that as we get into more of the discussion. But I think that's where sometimes those dermatology is maybe something good to complement what we're doing naturally and through nutritional medicine and herbal medicine, if that scarring is something that's present. So I would agree, Elizma, I don't know that there's much that we can do to potentially reverse that, especially if that's been something. And we know some people have been dealing with acne for years. That's 5, 10, 15 years they've had that chronically. So yeah.
So we'll get into nutrients a little bit later, but if the chances are or very limited that we can reverse scarring, do you think that we can potentially prevent scarring by keeping nutrition to the skin as best as possible, like vitamin C, collagen, that kind of stuff?
Exactly. I think that prevention, even if we can see someone that might have a bit of an acute onset of acne for whatever reason, so it's something that they've just started to recently notice, I think that prevention to support the integrity of the skin, connective tissue, that's where we can come back to nutritionally. And a lot of people we know in some of these key nutrients are deficient already. So from a preventative step, I think absolutely we can start to focus, and hopefully we can catch people before they get to that point of that chronic scarring.
Yeah. So there potentially could be like a reduced risk of scarring if they've got good nutrition. I mean, theoretically, if they've got good nutrition, they may not even have the acne in the first place. But let's say there's other factors like hormonal factors involved, which is a little bit more complex. If they've got good nutrition, good absorption, then I guess that could minimize the severity of scarring at the very least. Yeah.
Yeah, absolutely.
All right, so I guess we could move on to kind of like what the common causes are of acne.
Yeah,
and there's so many.
Very.
And this is where it becomes very individualized, right? Because we all will have different reasons for getting certain symptoms. And so, when I was researching this, there was a real big one that came up in a lot of the research studies, and that was dairy.
Yes.
So I think we can start off with something like that.
Yes.
Yeah.
So are we talking about a dairy intolerance here? Because we'll talk about food intolerances. But are we talking about a dairy intolerance here or something completely different?
Not a dairy intolerance. No. It's a specific compound in dairy that is the driver for that. So we can talk about that.
IGF-1 or insulin growth factor 1 is a big component of dairy, right? And, like I said, it can bind to insulin receptors. Now, we already know that insulin is a growth factor. It's anabolic, right? So that's what builds muscle, makes you put on weight, all of that kind of stuff. So growth can also mean cellular growth. So it means more cells dividing, more oil being produced. That kind of like proliferation kind of aspect, just overgrowing of tissues and things like that. And it was very interesting. There was a study that showed that there was a huge correlation between IGF-1 and the hormones dihydroepiandrosterone sulfate and dihydrotestosterone, which is DHT, which we'll talk about soon when we get to the hormonal aspect, right? So there's a huge association between those three and the severity of acne. And the real interesting thing was, because, this was a study that was just basically done on dairy consumption, and they kind of looked at, well, is it just milk, or is it dairy in general? So they tested it for non-fat milk, high-fat milk, yogurt, cheese, all kinds of dairy products. They found that pretty much all of them had a role in raising that IGF-1 and triggering acne or the increasing the severity of it. But as we know, sometimes it's not always as simple as that. In this study, they found that 1 glass of milk a day certainly aggravated acne. But if you had, let's say, 2 glasses of milk in a week, it didn't really have much impact. So I guess it's that thing that you commonly see in our practice. It's sometimes the bucket full, right? So each person may be different. Like some people may have to avoid dairy completely for their skin health, and others may get away with a little bit that they'd have to experiment with and how much they can kind of get away with.
I think on that, Elizma, I see it more and more with clients, is that I don't think people realise then potentially how much dairy is coming into their diet on a weekly basis. So when you sort of query someone about it, they might say, I have a little bit of butter, I have some cheese here. And then when you start to go into it, they're having serves of that every day and across a week. That's really adding up. So often, I guess my initial approach to that, if we're dealing particularly with acne and I think we need to remove the dairy, is go completely dairy free and be quite strict with that to see what results we get after, say 8 to 12 week period of removing that from the diet. So I think, like you said, it's that bucket, it's that accumulation that people have. So
agree. I think the milk solids is a big one, because milk solids is in a lot of if you kind of read the packaging. I mean, I've seen it in sauces. I've seen it in I think even in bread. I've seen milk solids pop up, right? So it can pop up in very strange places. Whey protein powder. We often forget that that's also a form of milk proteins as well.
And what is dairy? It's milk that it's to grow a cow. So, you need to give all these nutrients to make this cow who, grow to be quite big. So, essentially that's what you're then putting in your body. So, of course, it's can have some negative effects.
Exactly. Babies have to grow. So, absolutely correct. So, you don't want much of this IGF-1 kind of compounds. Dairy was just a big one. And so I guess that's also where the distinguishing factor comes in, that we're not talking about dairy intolerance as a dairy intolerance. We're not talking about the casein protein or the lactose or anything like that. So lactose-free milk will probably have exactly the same effect as in raising that IGF-1. You may not necessarily have to have gastrointestinal symptoms or gut symptoms to validate reducing dairy when you have something like acne. So I found some interesting other things as well. Like, when we looked at dairy and we realized it was the IGF-1 that kind of, perpetuates this acne pattern, I thought, well, what else can stimulate IGF-1? Because, it won't just be dairy. And I found that smoking can stimulate IGF-1. High glycemic index diets, which is just basically high sugar diets. High protein diets also came up, and I thought, I didn't look too much into it, but I guess that's because some amino acids, especially your branched-chain amino acids, can be insulinogenic, or have that same kind of factor. Maybe that's the reason. Hyperthyroidism was another one that could raise IGF-1, and pregnancy was another one, which may explain why some women, get acne when they're pregnant, whereas they've never really had acne before. So those were some of the common ones in terms of dairy and IGF-1 and things like that. But I guess a flow on from that is leaky gut and actually food intolerances. So how could that play a role in acne formation?
Well, I guess when you look at that potential for leaky gut, Elizma, it's the dysbiosis. So when we look to the gut microbiome, if there is any sort of dysbiosis in terms of the bacteria that are there, so potentially dysbiotic bacteria, commensal bacteria that have now overgrown. So we look at that direct link between, say, skin microbiome dysbiosis and gut microbiome dysbiosis. So that gut-skin axis. Now, there's a lot of questions, I think, around that. The research still is, I guess, moving into that direction. So as I was looking through around the gut-skin axis connection for acne, there's not too much out there just yet. But we know that then from a level of there's bacteria on the skin, then we consider, okay, what's happening in the gut? And so if that's something that is left, so someone has that dysbiosis for a long-term period of time, we then consider the potential for leaky gut. So now the membranes are affected in the gut in the same way that we would relate that to connective tissue and the skin. So when we consider then leaky gut, we know food intolerances can be a big factor on that. So this is where, yes, if you do have a dairy intolerance, that's going to be something impacting that, absolutely. But then other things like gluten, soy is another one. Sometimes people can be quite intolerant to eggs. But then even, we start to go into then all of your salicylates, amines, oxalates, those sorts of things as well that people might be reacting to leading into that leaky gut as well. So food intolerances are a big one, I think.
Very good point, and I think small intestinal bacterial dysbiosis, or SIBO as it sometimes is known, within the small intestine, that's part of that leaky gut and the whole gut permeability thing, could also play a huge role in acne. At least that's something that I see in my practice.
Well, I think I was reading some studies on the numbers of SIBO, people with acne that actually have SIBO, and it's quite high. So there's a correlation there with that. So,
Yeah. So, I mean, and it kind of makes sense, right? Because if you think about SIBO being in the small intestine, you have a lot of enzymes and digestive process that has to happen in the small intestine that doesn't happen necessarily when there is organisms growing there that shouldn't be growing there. So the things that come to my mind is your DAO enzymes, which has to break down histamine, right? And we know histamine is involved in swelling and redness, so it may not necessarily be the cause of the acne, but it could certainly aggravate it and flare it up, can't it? Yeah.
Well, one of your most common high histamine foods is cheese. So there's that connection there already. So if someone's having a histamine response to that, and they've probably got some underlying dairy intolerances, and then they have acne, there's that definite connection there. So, and fermented foods is another one. So that could be exacerbating people's acne. But I think histamine is one we see often as well. So
very good point. Salicylates I'd include here as well. That's the PST, or the phenol sulfur transferase enzyme in the small intestine, that can also be compromised by bacteria, because it's like these bacteria, they interfere with these enzymes, because these enzymes, they sit on the little brush border cells inside the small intestine, and they're just there to digest foods and digest compounds. But if you have bacteria kind of growing there, they interfere with that whole enzyme digestion process. And the PST enzyme having to digest amines and salicylates. Amines, again, very high in cheese. But then salicylates, which is like found in a lot of your fruits and vegetables, it gives the color and the flavor to spices and herbs and fruits and vegetables and things like that. So it's good for you. It's not that salicylates are bad, but if you struggle to kind of process it, then you can get the redness and the flushing, which could potentially also, I guess, aggravate, especially a rosacea type acne pattern, right?
Yeah.
And then, will also interfere with nutrient absorption, nutritional deficiencies, all of those kinds of things.
Exactly right, Elizma. And I think just touching on, we'll get into that, but the IGF-1, while we're a little bit on that subject, I was looking through, and there's definitely a direct influence on androgen regulation in the skin as well. So this is where we start to see that potential androgen signaling and the activation of the 5-alpha reductase enzymes. And we'll go into that, where androgen issues can be associated with acne onset, but we know that 5-alpha reductase enzyme is highly androgenic. So if that's upregulated, once again, through insulin, the IGF-1 increases in that, we start to see, is that the driver for someone's acne? And I think what I guess a pattern that I've seen a little bit more is that we're getting more and more later onset acne, so in adulthood, rather than the typical adolescence, teenage years. And I'm seeing that from a hormonally driven aspect. Now we'll go into some other imbalances there, but I think androgen is one that I see in more women in their 20s and 30s that's showing through now. So they've got this androgen issue, potentially 5-alpha reductase issues, and so on from there. So
yeah, that's interesting. Now let's talk a little bit about the hormones. We can always come back to some of the bacterial aspects, because it is that dihydrotestosterone, right? That is that direct link. And you're correct, Danielle, when you said that that's that IGF-1 that drives up that 5-alpha reductase, takes that testosterone, turns it into that dihydrotestosterone. And we know that dihydrotestosterone, I can't remember, is it 10 times?
10 times.
Yeah, it's 10 times more potent than testosterone. So what's the kind of typical, apart from the fact that you get acne, what are some other telltale signs or symptoms that can make you think that, my issue may be an androgen dominant issue?
It's that androgenic alopecia, so we touched on that in one of our last podcasts, so that's definitely one. Hirsutism, so the excess facial hair growth, and other hair growth in other areas, but we often see particularly the chin, in some women, that darkening of the hair. Mood changes, it sounds interesting, but I find even increased, particularly anger, irritability and frustration is tied up into that androgenic type picture. So they would be my top three realistically, Elizma. And then we sometimes, now not all the time, see that correlation with PCOS type pictures as well. So if someone does have PCOS, it is an androgen associated PCOS, they might be experiencing a lot of these symptoms as well.
And I guess because it's the IGF-1 that kind of fuels this kind of conversion, I guess weight gain maybe as well, a lot of women with PCOS and hormonal dysregulation like that can get that kind of weight gain picture too,
Yeah, definitely. I'd say not always, we see the slim, the slim women that have maybe PCOS as it's diagnosed for them, or they've got acne, or they've got these pictures. But I would say too, it's looking into even that adiposity, so that central adiposity. Sometimes that can be quite androgen driven as well. So they're holding a lot of that fat in that abdomen type region. So I think the androgens is something from a acne perspective that we always have to dig deeper into and understand if someone has that androgen potential there. So
you're right, with the abdominal adiposities, because that's generally where men put weight on, right? It's like the apple shape. Whereas women, we have the pear shape, right? But that's more estrogen kind of driven. So I guess, women who kind of don't put that much weight necessarily on the hip and thigh area, but more on the abdominal area, can be a sign that there's an androgen dominance going on there.
Absolutely.
And how do we test for it? If we think that, my acne could be to do with hormones, what kind of testing can we do for that?
Well, we usually start just with bloods, and we'll just test for the androgens. We test for insulin. You usually tell a lot by that. So, if we need to go further, we can do Dutch testing, which can tell us a lot as well. So, but a simple blood test can definitely give us a good indication of where their androgens are sitting as a start.
Yeah, I think SHBG also could be a good marker,
that's always a good one.
Yeah.
If you can get the DHT, the dihydrotestosterone tested, that's always a good starting point. So otherwise, we go ahead and do the Dutch, because then we can start to see everything else in combination. And I know we touched on this briefly before too, Elizma, with that sympathetic nervous system dominance, so high stress, and where DHEA that is produced by the adrenals in potentially those situations of high stress, chronic stress, is an androgen. So DHEA has very androgenic effects in the body. It's also, we often see that direct correlation with inflammation, high levels of insulin or insulin resistance with high DHEA. So that can also be something from an androgen perspective. Maybe you don't have extremely high levels of DHT. Maybe you don't have, that potentially high testosterone classically in PCOS type women, but maybe you do have these adrenal hormones, particularly DHEA, being produced in very high amounts.
Good point. And so that would be more like also a ratio difference between the DHEA and cortisol, right? Because if you've had long-term chronic stress, your cortisol may be like really flat, but you may have higher DHEA, right? So that would be like a typical pseudo-androgen kind of pattern without the testosterone and the DHT maybe.
Exactly, Elizabeth. And I think, cortisol can be very catabolic, so breaking down, whereas DHEA, if in that ratio, so if we've got a high ratio of DHEA to very low cortisol, it's anabolic, so it's building up. And so I think when we start to combine all of this from a proliferation point of view that's happening, it's no surprise that maybe acne, it's just exacerbated, and I see even women that start to get acne on their chest, their back, shoulders, very, very mal-pattern acne presentation as well.
Yeah, because it doesn't always have to be on the face. It certainly can occur in other areas of the body, right?
Exactly.
Well, they're the high DHT areas, is the chest, the back, the shoulders, and the face are the areas where the DHT will actually localise. So that's why a lot of times you don't see it on the arms and the legs. It's usually restricted to those areas.
Yeah, that makes sense. Yeah, that definitely makes sense.
And Nick, you were touching about before in terms of when we look at a woman's cycle, and we can go into this now, looking at estrogen and progesterone. So we've been focusing a lot on the androgens, and progesterone is an androgen. What are you noticing, Nick, with when you're seeing clients and going through their cases with what's happening around their cycle and acne onset?
So it's very, it's quite common to see women that come in and they're sort of halfway through mid-cycle, so just after they've ovulated, and they start to get an acne flare. They don't have an androgen issue, but then we're looking more at what's going on with their progesterone. So then that's sort of another direction that we have to take there, because there is some women that are quite sensitive to that. So their higher progesterone will drive that acne flare there. So, yeah.
So when it is a high progesterone, like what time of their cycle would they tend to see the acne kind of flare up more?
So usually, it's 2 weeks before their period, about 14 days before their period. So that mid-cycle, so just after ovulation, obviously the progesterone starts to rise, and with that rise, then comes the acne will come along with that. So, and we have to remember the progesterone is literally, it's like the master androgen. Essentially, that's what everything else is coming off. So that's that can be a driver there as well. So.
Yeah, that's interesting because we forget about the progesterone. We just always think of the testosterone, don't we?
We do.
Yeah.
Yes.
Yeah. And another thing, there's a lot of women who can identify with the acne and menstrual cycle kind of thing, as opposed to just having acne all the time.
And a good indicator is, obviously we can go into herbs, but Vitex is prescribed sometimes for obviously cycles and things like that, to normalise cycles and bring your progesterone and estrogen levels back into balance. And some women that we put them on Vitex, and then their acne gets really bad that mid-cycle. So, and Vitex obviously will drive up progesterone. So that's a really good indicator that it's progesterone that's driving that acne.
So if progesterone is driving the acne, could it be to do with an imbalanced ratio between the progesterone and estrogen maybe, or?
I'd wonder, if would the 5-alpha reductase enzymes fall into that too, Nick? So if there's something that, if someone's potentially got that they've got that 5-alpha preference already in terms of that cellular turnover and metabolism, then we're boosting progesterone, which of course is hopefully helping their cycle, but then they're getting that trigger of then the acne onset, because the enzymes are still basically pushing them down more of that androgenic pathway. And so then I guess it's a question of, okay, well, if you're going down that pathway, are we addressing everything else, the insulin, the inflammation? Do you have the nutrients that can, downregulate the 5-alpha enzymes? And this will fall into what we're often going to for skin issues and acne is zinc. Zinc is definitely one of them. Selenium is another one of those. Then there's some herbs that I know you guys will use, things like the saw palmetto, stinging nettle. So they might work on that. So then I guess it's almost going, well, okay, we're improving the progesterone. We're then seeing you're having this acne onset. Maybe we have to work within either using the Vitex or doing those things in the background first before we might trial the Vitex again and see if you then have that acne onset after that. So, and
that's where the Dutch comes in really handy, because we can see clearly what's going on and how to treat it that way. So we do use that quite often when we're looking at the hormones and what pathways they're going down.
Yeah. So that brings me to the next point, right? So there's also some medications or drugs that can be the cause of acne as well. And I'm leading into this because we're talking about hormones, because anabolic steroids would be a big trigger, right?
Yeah.
Because I've seen a lot of bodybuilders, both female and male, who get the cystic acne.
Very common. Yeah.
Kind of a telltale sign that
they're not natural.
Actually, interestingly, I want to bring in the Dutch test again here, but there's that marker on the Dutch test, the epitestosterone. And so what you can actually start to see is that from when you're looking at someone's DHT, because I've seen that often people they've had a history of those steroids, that their epitestosterone to the DHT ratio is highly affected. So basically epitestosterone is it's basically another metabolite of that testosterone, and it should always be in a healthy ratio. And what will happen is that the DHT will skyrocket and the epitestosterone will plummet. And so we see that this huge imbalance between, okay, well, now their body's not even producing natural amounts and healthy amounts of testosterone and epitestosterone, and that you've got these really high amounts of DHT. So
that's a good little perler. Yeah, I like that. Yeah.
So also too, if you ever have someone out there, ex-bodybuilders or anything like that, I always go to the testosterone, the androgen breakdown, and that can start to definitely tell you some signs there. So
that's interesting. So someone who may have used anabolic steroids and then stop, let's say it's 2-3 years later, and let's say the testosterone production hasn't really come back on, you'd kind of see both the epitestosterone and the DHT low, yeah?
Exactly, Elizma, exactly. So that's what you basically are then going in to look for from now their body trying to reestablish its natural androgen production. Is that epitestosterone coming back into play? Is it where it should be? And if it's not, you can basically start to assume there's been some exogenous hormones and testosterone that have impacted that. So
good point. There were some other medications as well, corticosteroids and lithium. So lithium is commonly used in mental health, with certain mental health disorders. So they seem to also be potential triggers for acne as well. One of the things that I thought would be really interesting to talk about, whilst we were kind of like on the small intestinal SIBO thing, because that's going to lead into a lot of nutritional deficiencies, is gallbladder and bile production. Because that's a big issue with SIBO, right? In my opinion, it's one of the big drivers of small intestinal bacterial dysbiosis and why a lot of people keep getting it back. Now, the reason why we bring bile in is because a few factors, and I know that you guys have done a bit of research on that, is that bile acids, first of all, is very important in activating retinoid receptors. And retinoid receptors are dependent on vitamin A. Vitamin A and vitamin D are also fat-soluble vitamins, so we need bile to absorb those nutrients. And these are nutrients that feature big time in something like acne, don't they?
Absolutely. And interesting you say that too, Elizma. I wish I could go back and find it, but in terms of zinc's role as well, so isn't zinc then also going to activate that vitamin A release from the liver?
Yeah.
So zinc, if we even start supplementing with zinc, even if we don't use the vitamin A in conjunction, we're at least starting to help that along a little bit better. But I think the zinc, the vitamin A, the vitamin D, absolutely, in any sort of acne treatment is some of our first go-tos. So, and that bile is so important, and then adequate fats. This can then start to bring into, well, when we're looking at the skin, we need those fatty acids to support that lipid bilayer as well. Often one of our go-tos for treatment is omega-3s, and getting in those omegas as well. So adequate essential fats. So it's a nice little tie in there. So.
Absolutely. Yeah, because when I looked at vitamin A and vitamin D, they seem to play a huge role in the cellular proliferation. So when vitamin A or vitamin D is deficient, cells will tend to turn over a lot quicker, and you can get that where you have way too many epithelial cells or skin cells in those pores that can clog them up.
Yeah.
I think vitamin D is also, I think we spoke about it previously, deficiency in psoriasis. Same reason, it's that overproduction of skin cells where it just goes a little bit out of control.
Yeah, because there's also a connection with PCOS and low vitamin D as well. So coming back to that again. So vitamin D deficiency may be linked to the pathogenesis of insulin resistance and the metabolic syndrome in polycystic ovarian syndrome as well. So there's that connection again back to that. So it all sort of loops around together.
And again, we see a lot of vitamin D deficiency in our clients, don't we?
So much,
Yeah, that's really
very
common.
Right, so, that kind of gives us a good kind of idea of nutrients. Danielle, you mentioned selenium, you mentioned zinc, you mentioned omega-3s, vitamin A, vitamin D. There's going to be a whole bunch of other nutrients as well. We can't just always simplify it like that, but they're probably big ones, in terms of skin nutrition. Whilst we're on that, we've kind of talked a little bit about we actually talk a little bit more about the gut microbiome. We want to kind of talk, after talking about the small intestinal area, we also have to talk about the large intestinal area, because this is where short-chain fatty acids get produced, right? And short-chain fatty acids, depending on the ratios and which type of short-chain fatty acids, are generally anti-inflammatory. Because remember, acne is an inflammatory condition. So keeping your microbiome diversity healthy could also play a big part in reducing the incidence of acne.
Exactly right, Elizma. And I think that comes back to when we're starting to look at someone's diet. So we go, okay, well, let's remove the dairy. Let's definitely take those refined sugars and refined starches and carbs out of your diet. But let's then add back in things from that fiber perspective, plant polyphenols, those sorts of things that are going to then support that short-chain fatty acid production and balance within that large intestine. So butyrate is one of those most common short-chain fatty acids that we look to enhance and improve that production in some way. And where that's going to really be an anti-inflammatory action on the colon and supporting that overall. So, and I guess as we're looking at the large intestine, it seems very simple, but when we come back from a point of inflammation, and also now we start to see acne as something from a toxic type buildup on the skin, how else are we then supporting detoxification as well? And proper bowel movements is one of the first places. So in line to start to reduce the dysbiosis, improve that gut permeability overall, can we just actually make sure that this person has got adequate healthy bowel movements happening every day as a form of that detoxification? And fibre falls very, very firmly into there. So
I love that. So we have the bile for detoxification as well, and then we have the large intestine for that phase 3 detoxification, right? Mm-hmm. And you know, when you look at the short chain fatty acids, absolutely right. The butyrate is usually the big one for anti-inflammatory action. And what I found is, especially if you do like stool analysis testing, sometimes you find that they're all in balance, but the butyrate may be very low normal and your acetate short chain fatty acid may be very high normal. And that kind of pattern is very common in metabolic syndrome. And metabolic syndrome has got to do with insulin and stuff like that. That'll be IGF-1. You know, we get back to that proliferation, growth, anabolic kind of pattern, inflammatory pattern. So depending on what type of bacteria grow in your large intestine and the food that you feed them can have a systemic inflammation effect or anti-inflammatory effect which can then affect the skin. Because the skin is really, I always tell my clients this, the skin just tells you there's something else going on in the body, right? It's just a telltale sign.
Well, I mean, if your body can't get toxins out through its regular channels, it's going to try and push it out somehow, and so the skin is the next thing. So yeah, I always say whatever's going on the outside is basically a bit of a picture of what actually is going on the inside. So
yeah, because I think your skin is one of your largest detoxification organs.
The largest.
Yeah. But also then to think about what the skin is exposed to, it takes the burden of that environmental toxic load every day as well. So of course then things will get absorbed through the skin and we see that systemically, but it's something that we have to continue to come back to. How are we nourishing it internally first and supporting it from the internal so that starts to reflect on the outside as well? So
it's almost like the skin is your lungs. It's just like a kind of a lung, isn't it? It breathes in, but it also breathes out, right? So it can breathe in those toxins, but then it can also breathe out toxins that can't be eliminated through the liver and the bile and the kidneys and all of that.
Well, sweating's a very big detoxification mechanism. So
yeah, and that comes back to, once again, simple but adequate hydration as another form of detoxification, supporting the kidneys to then excrete those toxins as we need to. So
and the lymph, I think
the lymph is huge.
Does anyone want to talk a little bit about the lymph?
Well, we've got to do things to, like, the lymphatic system is something that we have to continually be actively stimulating. It's not something I was laughing because the lymph doesn't just move on its own. We've got to do things to support that. So it sounds, even simple, but like you were saying, Nick, exercise, movement is a way to support lymphatic health. Another accelerated way of sweating is things like your infrared saunas and things like that. You might add that into your routine to help with increased detoxification. But really then looking at even sometimes manual therapy, so getting lymphatic massages, anything that's going to help move things through that lymphatic system is also going to be so important for then your skin health overall. So
yeah, we don't have, sorry, Elizma, because like with our blood, we have a pump that pumps our blood around. With the lymph, we don't. So what actually moves our lymph around is our muscle contractions. So that's why that movement is really important there. Even things like dry skin brushing can be really effective just to move that lymph around.
Yeah, and you know what? The dry skin brushing may be a better option here, because with acne specifically, sweating is not always a great, it can often aggravate it, right? Yes. And even heat, which can be driven by sauna or exercise, can create like a histamine release and can also kind of flare up that acne temporarily as well. So dry skin brushing is unlikely to do any of those things. That could be a great way of kind of moving that lymph without aggravating anything.
Yeah.
Lymphatic massage is another really good one as well.
Yeah, definitely. All right, so what about the skin microbiome? Because we know that the gut has a microbiome, and we've talked a little bit about that, but our skin has a completely different microbiome, doesn't it?
It does.
Yeah. So what's the typical, we can talk about what the typical kind of commensal bacteria is on the skin. I think there's a variety of them.
Yeah, I think on the main, there's 4, Elizma, that I came across. Bacteriophylla would include the actinobacteria, firmicutes, proteobacteria, and bacteroidetes.
Absolutely, yeah. Mm-hmm. What I found is like that's the kind of general commensal bacteria. I think we talked about it in the eczema podcast. With Matt and Steve, we talked a lot about the skin microbiome, and when you looked, Steve at that point pointed out that there's different bacteria, so they're in different ratios, I should say, in different parts of the body. So even though you find the same bacteria, they're not in the same ratio on the skin as they are in the skin folds, as they are on other areas of the body. So they will kind of differ in their kind of ratio and the numbers that they are in. But that's kind of like your general kind of bacteria. And what they found in acne is that there are certain species that will tend to overgrow more than other species that can give rise to, the pus and the redness and the swelling. Now, one of those species, I think, was the Propionibacteria acnes, right? Mm-hmm. But they've changed the name, didn't they, Danielle?
They did. It is the Cutibacterium.
Yeah. Cutibacterium. It's not very cute, though.
No. Sounds more like cuticle. But Cutibacterium acnes, that's apparently the new term for it. Mm-hmm. Apparently, that's a relatively common one. Although, Danielle, I think you had some statistics that showed that it only made a small percentage?
Yeah, through my reading, Elizma, basically it makes up about 6% of that total bacteria. So when you think about, what other bacteria fall into there, we've focused so heavily, the research in the past, on this particular, the P. acnes. And we're starting to understand that maybe it's not always, and if not even the main driver of acne in people. So I think we've got to look elsewhere, and we can't just pin everything on this one being the main one. We can't think that this is the main pathogen that we have to deal with. So,
because there's a few others, like I know Staphylococcus epidermis is another species, and I've had some clients with acne where, they take the swab test and they say, well, it's a staph infection or whatever. But I find that Staphylococcus epidermis, which is a natural bacteria found on the skin, actually has a protective effect. It seems to kind of suppress the growth of that Cutibacterium acnes, which seems to do the exact opposite and reduce the risk or the incidence of acne, or the severity of it, which I found was quite interesting. But what I also found interesting is that a lot of these bacteria are also biofilm producers. So when you have acne that is triggered by a bacteria, it usually, and especially a lot of them are antibiotic resistant, and a lot of them have biofilm. Biofilm is kind of like a layer that I always call it like the cities or the houses of the bacteria. So they live in these cities, and that's how they communicate with each other. But it's also protection. So bacteria, when they have biofilm, it makes it harder for antibiotics to reach them or to kill them off, and they just become a bit more resistant. But that could be a reason why maybe some people don't respond to antibiotics when it comes to treat antibiotic type treatments for acne.
Absolutely. And I think, like what you said there, Elizma, with say someone was doing a swab of that acne and they did come across the Staphylococcus, was it the epidermis that could have the resisting effect to something like the Cutibacterium, is that if that's found, it's not to say that is that such a bad thing? Is that something that we then just go in with antibiotics and go, well, we need to try and kill that off? It's actually there doing a job. It's trying to support that skin layer and that lesion in the skin in some way. So, and I think antibiotic resistance is something that we're coming up more and more against, not just when we go to the gut microbiome, but then what people are using for the skin microbiome as well. So,
and I guess the skin microbiome is exactly the same as the gut microbiome, right? We have to kind of ask, it's fine to say, well, the bacteria are not disproportionate on the skin, so that's why you have acne. But I guess there has to be something that kind of triggers that bacteria to become disproportionate as well. So, I'm just going to think of stuff like maybe washing the face with things that may be killing off some of the commensal bacteria. I don't know. I know, in the eczema podcast, we talked about hand sanitizer killing off a lot of bacteria, but obviously you don't use hand sanitizer on your face. But I guess anything that can disrupt that microbiome, maybe even foods. I mean, I don't know if food that we eat will change the skin microbiome as it does our gut microbiome. Potentially it could. I'm not sure. But I guess we have to kind of also look at it from that perspective too.
Yeah. Mm-hmm. I guess looking at the external influencing factors, Elizma, it sounds, it does sound simple, but people can then be very prone to over cleansing, over exfoliating. Now, we have that many different products that are sold to us to use, for facial care and things like that. Is that stripping away a lot of our natural layers of protection and allowing some of those bacteria to grow and proliferate? That could be that could definitely be an option. I think particularly with women, and this is where it might become more relevant, is even things like makeup. So we're using particular brushes and things like that. If we don't have good hygiene with those brushes, so we might be constantly using this brush on our face, it's getting exposed to the outer environment, bacteria begin to even surface on there, and we're putting that directly onto our face every day. That could be another thing as well. So
yeah, especially sharing makeup, right? Because that's a big no-no.
Yeah,
you're not supposed to do that, right? Yeah. I've done it a few times. Twice.
I don't know the lips. I don't understand women who share lipstick. I just find that weird. I'm like, literally, that's been on your mouth.
Yeah, yeah. Couldn't do that.
No,
that is definitely weird. Right, and then I found also, we talk about bacteria, but there's actually also fungal organisms that can trigger acne formation on the skin. I found a species called Malassezia species, which is a type of a fungal organism very commonly associated in acne. Now, of course, in this case, an antibiotic is not going to do much. You'd have to use an antifungal with something like that. I've personally also seen, this probably relates a little bit more to the gut microbiome, but I've seen people with candida or fungal overgrowth getting really bad rosacea. Not necessarily the cystic acne, but that kind of, the redness and the scaliness and all of that kind of stuff as well. Mm-hmm. So definitely there can be a lot of organism involvement in, in things like acne and the different forms of acne as well. Now, anything else that we can talk about in terms of causative factors? I think we've kind of covered everything in terms of what can cause acne.
I think so, Elizma. Whether I just start to think as well, one, if we go into medications that is often used to treat acne, but then a causative factor is coming off of that medication, as in the oral contraceptive pill, so post-pill acne.
Yeah.
So is that something that we want to dive into a little bit? I know it's very common.
Then let's do it, because a lot of women, that's one of the actual common treatments is putting a woman on an oral contraceptive pill, right? And a lot of them can be put on this as teenagers. So, because when we talked to Lara the other day, and she mentioned that there's an androgen surge as puberty sets on. There's first that androgen surge, right, that then sets it up for all the other hormones to come into play. So that may be a reason why a lot of teenagers, both boys and girls, get the acne kind of like as they go through puberty. But then what a lot of doctors may do is put them on the oral contraceptive pill for their skin, because they're self-conscious and all of that. But then what happens when they come off it, when they want to fall pregnant, when they're 22, 23?
Well, that's when it all goes sideways, doesn't it?
Yeah.
So, if you've been putting on an oral contraceptive pill because you have acne, that doesn't fix the acne. That just basically prolongs the point of when you actually come off it. You're going to have the same problem. The problem isn't fixed, and it can be even amplified, so it can be even worse than it was originally. So, we see people that girls that had acne when they were young, and they go on the pill, and they might have been on the pill 20 years, and their skin is fine, and they come off the pill and it's just an explosion. But we also see young girls who were on the pill that didn't have acne. They were on it just for contraception, and they come off it, and then they get the acne as well, and they'd never had it before. So that just shows the mechanism of what's going on there is what happens when you are put on the pill and what it suppresses, and then when you come off, and then what actually just will shoot up as far as hormones. Yeah,
that's it, Nick. Because even those synthetic estrogens and progestins, so in the pill we know it's not progesterone, it's a progestin, that will suppress sebum. So it's suppressing that oil production. And so basically when we've got something that's inhibiting that, the body will then try to re-regulate itself and produce more of that sebum. And what we see is then this vicious cycle of suppressing the body, then trying to upregulate that. And so when someone does come off of that pill and we take that away, that increase in androgen production is triggered, as you were saying, Elizma, definitely. And then also we see this increased sebum production, which is trying to be compensating for us suppressing it for however long we were on the pill. So then you get this sort of cocktail, I guess, of increased sebum. Now you've got high androgens. Then you've probably got, sort of external factors, the imbalance of the skin microbiome, and then you've got this vicious acne onset. So
I like that you said that, yeah, because I've often thought whether this, even though acne is defined as increased oil production, increased cell production, and then clogging up the pores, I often wonder if this doesn't start off with the opposite, the dry skin, not enough oil, because the purpose of that oil is to get all that dead skin cells out, right? So, if you don't produce enough oil, it's not going to get those dead skin cells out, right? So it often can start off with something like that, where at first is the dry skin, and then, as you say, everything overcompensates, and there's obviously a whole bunch of other systemic issues as well.
Exactly. Well, isn't, if we look at another medication, Roaccutane, that's heavily drying for the skin, isn't it? So that's absolutely, if we look at that stripping away all of that oil production, so yes, then nothing can essentially proliferate, but when someone comes off of that, it's just once again accelerated, and their body is trying to find that balance again. So that's a huge one. And even another topical, if we look at that, is it benzoyl peroxide?
That's right, benzoyl peroxide.
That's it, peroxide. I would say that's heavily drying for the skin as well. So,
well, that is what you commonly see. Like I remember, kids when I was in high school who were put on Accutane, and they had just peeling, like dry skin peeling off.
Yeah. That's quite worrying.
No, I think they put them on it for about 6 months or something. That's about the time frame.
Yeah, but you hear of people that have definitely been on it longer than that, haven't they? And they've done multiple courses. I know some women that they sort of did it when they were in their teens, and then they've gone back on in their early 20s. They just keep trying to find a solution, and that definitely isn't the solution, and that can be highly toxic as well.
That's right. It's got some side effects, doesn't it? I know one of the things they say is if you're a woman of childbearing age, you should not be on Accutane without using birth control or some kind of protection, because it can cause, fetal malformations and things like that if you are on something like this.
Yeah.
Well, that's the standard. If the doctor does prescribe it, they will always prescribe the contraceptive pill with it for that reason, because the fetus will die.
Yeah. Well, that's at least responsible to prescribing the two together.
At least they're balancing it out.
But yeah, I mean, you point out a good point as well, is that a lot of women or people will go off it, maybe the acne returns, and then they'll go back on it again, and it's just another clear indication you haven't treated anything necessarily. It's just that symptomatic thing of drying up all the oil, which is not really always. I mean, some people do. They use Accutane. Acne is gone, never have a problem, so it does work for some, but you do run that risk of it just not really addressing the core issues, right?
I've seen even clients that have been on Accutane for years, and they come off it, and they might have been off it 10 years, and their skin is so dry they just cannot moisturise their skin at all, and that can be an ongoing effect of that as well. So
I wonder if it can kind of, like, with using it that long, whether it can have like a more permanent effect on the oil glands.
I think so.
Yeah. That's worrying.
It is worrying. Yeah.
Another common, there's some other really common topical treatments as well that we often see, both, I guess, medical, but also in a lot of beauty products, is the retinoids, the vitamin A derived products. They put that in a lot of skin products as well. often used for acne as well. Apparently, it unplugs the pores and can also stop, whiteheads and blackheads from forming, and also has an effect on those bacteria as well. So that's another common one. There was a few others like, azelaic acid was another one, salicylic acid. So all of these can be quite drying on the skin. We talked a little bit about the oral options. The Accutane was one. Then in terms of hormones, like the typical medical treatment, if it was like a testosterone androgen DHT issue, what's the kind of drug that they would use there?
The spironolactone is often, so aldactone is often what its actual name, Elizma. So that's often what people get put on to deal with that anti-androgenic effect as well. So,
but of course you can treat it naturally, as you mentioned earlier. The herbs like the saw palmetto, the nettle root, nutrients like zinc and things like that as well. Yeah. But that's kind of like what the medical treatment. The oral contraceptive pill, like we've mentioned, that's another potential treatment. But as we said, not really
temporary treatment.
I wouldn't even call it a treatment. I would call it a
Band-Aid.
Yeah, we call it a Band-Aid. Antibiotics, we've talked about the bacteria on the skin. So I think a lot of first-line treatments for acne before they even look at hormones would probably be antibiotics. Some common ones I think they use is like erythromycin, tetracyclines is also very common. And so with the antibiotics, like with everything, I think it can be a bit of a hit and miss, depending if you're using the correct form of antibiotic, whether it's, the species they have is resistant, so it can be a bit of a hit and miss. Another interesting one I found is metformin. So metformin is sometimes used for treatment of acne as well. And that's because of that IGF-1 factor or perpetuating factor there, which I thought was, quite interesting. But, I guess from our perspective, you may as well just go on a low glycemic index diet and get the same,
same effects.
And it's probably going to be a bit healthier for you because metformin has its own issues, doesn't it? It does. Interferes with B12 absorption and other things as well. There was another really interesting, kind of while we're on the IGF-1, because there's a couple of things that can reduce IGF-1, right? So if we want to kind of suppress that IGF-1 that drives that acne, of course a low glycemic index diet, low sugar diet, cutting out dairy is a big one. But I also found that caloric restriction and fasting as well as exercise can drive that IGF-1 down and potentially be beneficial for acne. And they also found that women with high intake of dietary folate had lower IGF-1 levels as well, which I thought was
interesting.
Very interesting. Because where do we get our folate from? Dietary folate.
All of our beautiful green vegetables.
Leafy greens.
Yeah.
Eggs, I think, is another one, but definitely the leafy greens is the big ones. Yeah. Broccoli and all of that kind of stuff. So a lot of things we can do with diet.
Yes,
so
absolutely. I think in terms of topicals, Elizma, I just wanted to bring up one that I found interesting because from a natural perspective, there's not a lot of research at all out there on topical uses for acne. But one that I did come across was it was a randomized placebo-controlled study done in 2018, so quite recent. And what they actually did was create a topical cream containing 20% propolis, 3% tea tree oil, and 10% aloe vera. And it was compared to 3% erythromycin cream in 60 patients with mild to moderate acne. And basically it showed significant improvements in especially those lesions and scars compared to the erythromycin group. So really looking at natural alternatives and looking at where we can get not just supporting that skin repair and I guess soothing, particularly with something like the aloe vera, but then we look into things like the anti-inflammatory properties, antimicrobial, particularly of things like the propolis, the tea tree. So I found that really interesting as a potential topical for people to start. Well, hopefully something like that gets properly developed because I know there's not a lot out there on the market.
And not really in the natural treatment, right? Because one of the other things I found is also witch hazel. So witch hazel is like an astringent, isn't it? It closes up those pores. Because a lot of people with the acne, they have those enlarged pores as well, right? Yeah, so diluted witch hazel, I should say, as like a face spritzer, can definitely be used. And whilst I'm a big fan of oils, rosehip oil is probably the one that I would not use in someone with acne. I know that's kind of contraindicated with acne, is the rosehip oil, which is a shame because it's very high in vitamin C and all of that. But yeah, we need more topical treatments, I believe. On the concept of topical treatments, though, I believe there's some basics as well in terms of facial care, if you want to call it that, when it comes to acne, and we can talk a little bit about that, in terms of washing the face and all of that. So I think one of the big ones is not to overwash, like you mentioned, Danielle, and strip too much away. I think the guidelines is no more than twice a day to wash your face. And if you do wash your face, with lukewarm water and like they kind of recommend a mild antibacterial soap, but that's, that was found on a medical website. So just something that's not harsh on the skin, I guess. I guess for me, I would always be like looking for skin sensitive products, and possibly products that kind of like have the disclaimer of oil free, or there's other things you can look for. Phrases is non-comedogenic. Apparently that's a phrase that they sometimes put on skincare products, just kind of like say that this is good, this is fine with people with acne. So I guess just using products that doesn't have too many harsh chemicals and things in it.
Which comes back to what we always say anyway, and just in general, keep everything as natural as possible, So even just going for something really natural that can always help as well. And even things like making sure you have a clean pillowcase can, little things that you don't even think about like that can have the oil build up on it after maybe a week or something. So making sure that those sort of things are nice and clean. If you use face washes, change them every few days. As we were saying earlier, makeup brushes, make sure you're washing those.
Yeah, what about glasses? Wearing glasses, because I guess there could be some oil build up on the frames.
Yeah.
Telephones.
Yeah.
Well, that was more really the old telephone. I remember the big.
Yeah, I don't even put my telephone up to my ear.
So people these days they talk like this. But I guess if you're still in the old telephone thingy, how do you clean that?
Well, I don't have those iPods. What are they? AirPods. AirPods? I don't have AirPods. So no.
I find it very strange when people walk and they talk and I don't know what they're
I can't see them.
They don't have the wires that, you think they're talking to them.
You totally think they're crazy.
Oh, I know.
Feel better about
it. Or you think they're talking to you and you're answering
that. Sorry, what?
Yeah. It's just very awkward. Okay, so telephones potentially. But what about makeup? What would be the guidelines around washing makeup at night time?
Always wash your makeup off. And even with the type of makeup you're using, I would always recommend using a natural makeup, a mineral makeup, because actually it still allows your skin to breathe. And if you don't wash it off at night, it's not as harmful as if you're using the non-natural makeups. Yeah,
good point. I've never really liked the liquid ones.
No.
My skin always feels clogged.
Yes.
Yeah,
and the same. I just use a bit of powder. Use the mineral makeup, so I find them really good.
It lets, as you said, Nick, it just lets it breathe. And also when you're adding like a lot of those harsh chemicals from other makeup, are they stripping away some of those key oils and things that we need?
That's right.
Absolutely. Also, excessive sun exposure, because that can often aggravate, especially rosacea type acne as well, I guess. And also some of the medications that people may be on can cause, especially oral contraceptive pill, I think is one. Maybe some of the antibiotics, I'm not quite sure, but you can get pigmentation, can't you?
Even with some herbs, you can get the same thing, photosensitivity.
Yeah, St. John's wort, I think, is one of them. Yeah. So definitely good sun care. Not touching the face too often, I guess. And if you are going to touch your face a lot, wash your hands. And not squeezing pimples, I guess.
Yeah, that's the big one, isn't it?
That is a big one, isn't it?
You've seen that, the YouTube of, is it Dr. Pimple Popper?
She's amazing.
She's amazing. If you want to get your fix, just watch that and leave your own alone.
100%. 100%. But
really
also too, I think that's her, like she's basically saying if there's a pimple that you want to pop, particularly those cystic pimples, do it in a controlled setting where everything's sterilised. Yeah. When we're doing it at home, it's not sterilised, at all. So just don't pick them. Yeah.
as much as you might want to.
Yeah, no, that's right. What about putting things? I think you did mention about the tea tree oil in that formula. Like some people, I think, do like to put stuff on the pimples just to feel like they're doing something. So tea tree oil could be something to do there. Yeah,
diluted, definitely.
Definitely diluted.
Yeah. So no one go try this at home. Just mixing some things together. No. But there's a lot of tea tree, I guess. Skin formulations out there, so creams and stuff like that. So as natural alternatives, I think tea tree is probably one of the most commonly accepted and used.
Yeah, but a 15% dilution, I think, would be something like.
Just be careful, because some women or some people can develop dermatitis with using the topical tea tree as well. So you just got to be really careful with it, because it is very strong.
Yeah. So we'll try a little bit, see how your skin goes before you go and put it all over your skin and then regret it the next day. Yeah. That's something you learn with your skin. Is you just first try it out somewhere and then small steps. Other thing I thought to mention is facial scrubs. Is scrubs a good idea to use when you have acne?
I wouldn't recommend. I recommend scrubs when you don't have acne, just maybe once a week, just to clear out those pores. But no, it's too aggravating if you already have that inflammation there. So I would be avoiding them. I
agree, because it can break the skin, spread the bacteria. Yeah.
You don't want that.
No.
I think that was. I also thought about, we talked about how some people can get acne on the shoulders and the back and other areas. So probably if they're experiencing acne on those other areas apart from the face, it's probably wearing clothing that can breathe. Not where you can sweat a lot in and then hold all that moisture, which will just accelerate that bacterial growth, because bacteria grows in moisture. So probably more breathable, like bamboo, or I don't know. There's a lot of clothing these days that are a lot more breathable. So I thought that could be something. So in terms of natural treatments, I think we can kind of like finish off on a lot of that. So we've talked a little bit about natural skincare that you can use there. We've talked a little bit about diet. So diet in general, we talked, it's about reducing the IGF-1 stimulating kind of foods, which is the sugar and the dairy. I mean, high glycemic index foods would also include things like white potatoes and things like that as well, wouldn't it? Yep. So anything that can break down very quickly into sugar would be a high glycemic index food. So I guess, like following a typical, anti-inflammatory diet, like a low glycemic, plenty of omega-3 fatty acids and antioxidants, plenty of polyphenols, the colorful antioxidants in your fruits and vegetables and things like that. In terms of nutrients, we talked about zinc, selenium, vitamin A, vitamin D, again, omega-3s. Anything I left out there?
Vitamin C, definitely, for that connective tissue, collagen.
Vitamin E.
Yes. I guess from an immune system support, I know there's definitely some research out there around things like lactoferrin and, of course, probiotics, often indicated, prebiotics, of course. So if you're going down that sort of gut healing path and journey there, you might use things like that.
That's a good point. Yeah. So we're just talking about general nutrients here, but of course it'll depend on what your cause is. If it's more like a gut dysbiosis type thing, we're talking about a much more involved program to kind of clean up that gut and get things working again. I found a couple of herbs. Some other nutrients I found is also biotin and vitamin B5.
Yeah, so I was going to say B5, Elizma. There's some good research behind higher dosing of B5, isn't it, with acne? So yeah, I think that's one definitely. I mean, when we're looking at, once again, this is individualized and comprehensive, but often B vitamins are going to feature in there. We touched on folate before, how important that is. And if we come back to underlying causes and where we start to want to support more detoxification, methylation, B vitamins feature in that. So, but B5 isolated is something that has been shown to really support skin health and acne.
Yeah, but you're right, the B complexes, right? I mean, we use B complexes a lot for stress, nervous energy. We know that there can be stress components with acne as well. Because stress can have a variety. Stress itself suppresses the immune system, but it also changes the gut microbiome, which can then have all of these consequences that we've talked about, right? So stress can certainly aggravate acne, and B vitamins have always been like a kind of a go-to in people with high stress and all of that. So yeah, that was some of the big ones. I found a few herbs, out of interest. A lot of these are very traditional herbs used in acne. So you can get like cleavers, red clover, yellow dock, very common ones to use in acne. And then also the lymphatics. We talked about the lymphatic system, right? Mm-hmm. So there's echinacea, blue flag, dandelion, and pokeroot. So pokeroot is just it's a herb you've got to be very, very careful with because it's super toxic. So definitely you need like a trained herbalist to, dispense that out and kind of do that appropriately. But I thought, those were really interesting herbs. Typically just your lymphatic cleansers and your skin herbs. Burdock root is another one. It's also a very
yellow
good
dock
skin
and burdock
cleanser.
we use a lot of depuratives, so they help with the detoxification process. So they're the big ones. Oregon grape is another one as well that we use. Yeah,
and Oregon grape is high in berberine, isn't it?
Yeah.
Which can be antibacterial as well as anti-IGF-1.
Yes.
Potentially.
Yeah, and then the golden seal as well is high in berberine as well, so that's antimicrobial. It's also depurative. It also has some immune regulating effects as well. So, and garlic is another one that's really good as well.
Yeah, and garlic is high in sulfur, right?
Yep.
And the skin uses a lot of sulfur compounds.
Yeah, exactly.
For healing.
Even an interesting one is linseeds. So the lignans raise your sex hormone binding globulin, so that will help to bind up some of that excess testosterone as well. So it's another really cool one.
And potentially insulin too.
Yeah.
Maybe,
Yeah. And then we've got your anti-diabetic herbs. There's so many.
Yeah.
Anti-diabetic herbs, so your gymnema to help to bring down that insulin can be really good. And myrrh is a really interesting one. So it's anti-inflammatory, antimicrobial. And there was a study that showed that taking 25 milligrams twice a day for 3 months was as effective as oral tetracycline at reducing the number of inflamed acneiform lesions. So there you go. So that's really interesting as well. So herbs can be pretty powerful.
Yeah.
And absolutely, Nick.
Even anti-inflammatory herbs, right? Like turmeric,
anti-inflammatories. Yeah.
I mean, again, anti-inflammatory herbs is not going to treat the root cause necessarily, but can certainly calm down a lot of that excessive inflammation.
That's exactly.
Baked skull cap is another good one. Helps to reduce sebum in the skin. So
And I think it's also a histamine reducer.
it is. It's anti-allergenic as well. So
So tons of herbs.
There's loads.
Lots.
But of course, as naturopaths, we know that we would choose the herbs based on the symptom picture of that client and also what their cause is in acne.
Yes.
But the point being that there's a wide variety of herbs that can be used depending on what's driving that person's
Well, you've got
acne.
your DHE blockers, as you said before, your nettles, saw palmetto, even licorice can be mildly anti-androgenic, but then, like you said, we have to make sure that they don't have the high cortisol and things like that. So, you can't just go out and grab a heap of herbs and give them a go. Sometimes it doesn't always go well.
Sometimes it backfires.
Exactly. Even something like DIM, the diandromethane, methane, for if there's potentially the androgen picture there as well. So it can be quite anti-androgenic and can support that estrogen detoxification as well. So that could be another one for someone.
Yeah. Well, I think we've kind of like been very, very thorough with a lot of the stuff. I think we've covered a lot because we talked about what acne is, we talked about what it looked like, we talked about common causes, common treatments, and then also the way that we would treat it and like the kind of connections between the digestion and the skin microbiome and everything else. So I guess the message we want to send out to people is that you don't have to live with this, and even if the mainstream treatments have failed and have not worked, there are, definitely natural options. I think the diet for me is the big one. Look, you can do any treatment that you like, but if you're still eating something that's driving that inflammation, you're always going to end up back at the starting point again at some point, Absolutely. So that's always for me the foundation. And sometimes a lot of the things we've mentioned, especially the dietary stuff, it's so easy to just do that first before going on to antibiotics or any other kind of Accutane, any kind of treatments that do have side effects. Even herbs. Sometimes diet is all you need to do, and you don't have to pop a pill or do anything else, right?
Yeah,
that's right.
Exactly right, Elizabeth. I think often if we use a starting point, looking at someone's diet, let's work with that first before we even start really anything else. If someone's acne improves dramatically following that dietary approach, then great, we know we're on the right track. We probably don't need to do much more and support them there. But then it's also too, if they do the diet and they get some improvements, then we can go, okay, no, we need to look deeper now, and we need to look what are the other factors here. You know, are you someone that's got an androgenic issue? Is it cyclical around your periods? Is it driven by food intolerances that we need to investigate? Is it a toxin overload, so environmentally and chemically as well? So is it stress? Are you someone who's just producing a lot of androgens from the stress? So there's so many different factors that we can then look into, but the diet is always that starting point.
Yeah.
And I think it's good to mention as well, because we have kind of hammered on dairy a little bit here, is that you can get calcium from other sources than dairy, you know.
That's like that's the biggest frustration.
It's just good to kind of reinforce that.
The dairy industry are brilliant in their marketing.
That's right. So a lot of vegetables, I mean, broccoli is a high source of calcium, and broccoli is also a high source of folate, which, you know, has been shown to be beneficial here. So if you eat a well-balanced diet, you will be getting calcium from other sources as well. So don't worry about, you know, not getting enough calcium if you have to cut out dairy for the sacrifice of having a beautiful skin.
Exactly.
So,
I think I'd cut dairy out for that.
Absolutely.
I have. So a long time ago.
Yeah, absolutely.
Yeah.
All right. So anything else that anyone wants to add?
I think we covered a lot.
Yeah, I think we have.
All right. Yeah. Well, there you go. So there are things that we can do for dairy,
For dairy.
not for dairy. There's things we can do for acne.
Yes.
And sometimes it's much easier than what it looks like in terms of treatment. So hopefully our audience would have gotten something out of that.
Yeah.
Both the boys and girls.
Exactly.
All right. Well,
Thanks, guys.
nice to have you girls here, and we'll chat again soon.
We will. Yeah.
All right.
All right.
Thanks, guys.
Bye, guys.
Bye.